Thanks for staying with us. Now, high blood pressure affects 1 in 4 adults and is a major preventable cause of heart disease, stroke and death.
Joining us now is GP Dr. Brian Higgins with advice on spotting the risk factors and whether high blood pressure can be prevented. Morning, Brian.
Morning.
Hi, Brian.
How are you going?
First question I have to ask, and we've all had checkups and medicals and all that, and they put the strapping on and test the blood pressure. What is it and why are they doing that?
Okay, so everyone has blood pressure, right? What blood pressure is when your heart beats, it needs to push the blood out at a certain pressure to get around your body. When you have high blood pressure, it just means that the blood moving through your blood vessels, for some reason, is at a very, very high pressure. And above a certain limit, this can start to cause damage to the blood vessels and the organs through which they flow.
So, high blood pressure, obviously bad.
Yeah.
What about low blood pressure before we get into high blood pressure?
Low blood pressure is actually also bad. There's a sweet spot in blood pressure from what we call about your systolic and your diastolic blood pressure. So you'll often hear the doctors talking about your blood pressure is 120/80 or 125/82 or something like that. And what we're talking about is your systolic and your diastolic blood pressure. Systolic being when the heart is squeezing, and then the diastolic when your heart relaxes. So the blood pressure goes through the body like a wave. Okay. So what you want is you want your blood pressure to be somewhere maybe over 110 up to a max of 140 when the heart is squeezing, and then when the heart is relaxing, somewhere maybe above 70 to at a max of 90.
But we can't tell what's going on inside our bodies. So what are the symptoms to look out for?
That's the thing. Usually there are no symptoms. A lot of people will come in and say, God, doctor, I'm very dizzy, or I have a headache, or I just feel a bit drowsy. My blood pressure must be really high. And actually, to have symptoms from high blood pressure, your blood pressure has to be dangerously
Really?
high. Most people, about 1 in 4 people suffer with high blood pressure, and the vast majority don't even know. That's why we refer to it as a silent killer. It's actually the second leading cause of preventable death in the kind of Western nations. The first being smoking.
So that's why, as I said, when you go into your GP, it's pretty much the first thing that they'll do, and you kind of wonder, as you say, you're kind of going, well, I don't have any symptoms, I'm not feeling any kind of, dizzy lightheadedness, but it's something that you wouldn't necessarily know.
Yeah, I do it almost as a matter of course now. Almost every patient that comes into my room, I say, look, just sit up on the couch, we'll check your blood pressure, because 1 in 4 people are probably going to have high blood pressure. And the only problem about having high blood pressure is if you have it and you don't know about it and you don't do anything about it.
You mentioned it's preventable.
Yes.
What are the risk factors, first of all? I mean, what are we doing, perhaps, that we don't realise it might be driving up our high blood pressure?
Yeah. Now, sometimes some people just have high blood pressure. It's called essential hypertension. And kind of no matter what they do, their blood pressure is going to be high and it just has to be treated. But some people have what I would call modifiable risk factors that we can change. The biggest things being your diet, your really high salt intake, smoking, lack of exercise, and being overweight are the biggest factors.
So they're all things that you can address, and indeed for your general health. But there are things then, Brian, that you can't affect, unmodifiable factors. Are there people you come in, you kind of go, hang on, certain people are at higher risk? Who are the main risk?
So as you get older, your blood pressure is going to go up. So between the ages of maybe 45 and 55, about 1 in 3 people will have high blood pressure. And then between the ages of maybe 65 and 75, 2 out of 3 people will have high blood pressure. So you can't do anything about your age. Men are more likely to have high blood pressure than women. Then there's a little part, your ethnicity as well. You might be slightly more prone to having high blood pressure.
So if you have had a significant birthday lately, should you be getting your blood pressure checked a bit more often?
Yeah, definitely. The guidelines vary. I tell people generally to check it about once a year, and if it's fine, it's fine. Some of the guidelines say anywhere between once a year and once every 5 years. But definitely after a big birthday, say maybe 40.
Yeah, he looks great for a big 50.
Pop in and get checked.
You did mention there, and we saw that on the graphic, family history also plays a part. So you might often hear that your mum or your grandmother suffered from high blood pressure. Is it hereditary?
Yeah, absolutely. There's no kind of one specific gene that we know, okay, if you have this gene, you're going to have high blood pressure. It's a little bit more complicated than that. But if say, one of your parents have high blood pressure, or there's an early death in the family, if somebody's had a stroke or has had a heart attack, especially below the age of maybe 55, just go and get your blood pressure checked.
Just in terms of, okay, so you've gone to your GP and it's been shown that you have high blood pressure for whatever reasons. As you said, the factors in terms of lifestyle you can address. Further than that, though, what can be done to treat it?
Yep. The first thing I say to everybody is, how much exercise do you do? And people always go, I do loads, I walk everywhere. And I say, okay, how many minutes a day do you spend out of breath? And they say, well, what do you mean? And I say, well, if you're not out of breath, it doesn't really count as exercise. And you have to spend about 30 minutes a day being just slightly pressured for breathing to exercise your heart enough to reduce your blood pressure. So that and just weight loss, losing up to about 5 to 10 kilos can reduce your blood pressure by 20
Because
points.
is that putting a strain on your body if you have excess weight?
Yeah, absolutely. Yeah. Because when you think about it, if you're twice as heavy as you should be, your heart has to push twice as hard to move the blood around it.
Can you explain to us what white coat syndrome is? I think I have an idea, because a lot of people might come to you, you check for blood pressure, it's fine, but actually they are suffering from high blood pressure, and it might just be, once that week that it's relatively normal.
So what white coat hypertension is when you see a white coat to the old-fashioned doctor, your blood pressure goes through the roof. So I'd have a couple of people who'd come in and they'd be really, really healthy, and they'd come in and might just be a little bit nervous, and you check their blood pressure and it's skyrocketing.
Because it is stress-related as well.
Yeah, absolutely.
Okay.
But actually the blood pressure is normal at home and high in the doctor's office. So instead of me saying, oh, look, come here, take these tablets, and maybe just getting, when people don't need them, we'll often put a 24-hour monitor on. Yeah. So we put on a monitor on their arm, they wear it, they go home for the night, and it squeezes every 30 minutes. And then they'll come to me the next day with a report, and I'll say, actually, do you know what, you do need medicine, or you're fine.
And would you know that I think this person's a bit of a white coat syndrome person? They seem fine every other way. How do you tell whether that's the case?
I wish I could say I know. And sometimes you think, oh yeah, this person's definitely a white coat. But more often than not, when you're guessing, you're just guessing. And
nobody gets nervous in front of you, Brian. Anyway.
I think anyone would be nervous. If you're going to the doctor, it means you're not feeling well. So majority of people would be a little bit anxious about things.
Tell us about the tablets that some patients are prescribed for blood pressure. Do they work? Is it wise to take them?
Yeah, absolutely. If you're prescribed medication, take them. So there's 4 big classes of blood pressure tablets, and they all work in slightly different ways. They have slightly different side effects, and they suit different people better than others. Okay. So we usually should be very careful about what we prescribe and who we prescribe it to. The biggest reason why people's blood pressure isn't controlled is because they don't take their tablets. And so often we prescribe somebody a tablet and they don't want to tell us that they hate it. Like for men, the biggest thing is erectile dysfunction. For some people can feel very lightheaded, they can get swelling in their legs, or they can be urinating a lot.
They're terrible side effects.
Yeah, they're terrible. And people, especially for men in erectile dysfunction, they don't want to say it to you. So they just don't take their tablet, say nothing.
But you can't
and
swap
you're prescribing
to
more tablets because you think their blood pressure is not controlled. So that's why you have to really ask. And then but when they tell us about the side effects, we can say, oh, well, actually, that tablet doesn't suit you, so let's try this different type.
Oh, that's great.
And so then we can just switch it. So if the blood pressure tablets don't suit you, just tell your doctor and they can switch them.
Can the effects be reversed then in terms of the damage that it's done? If you've been suffering for a while and you say that it puts strain on the blood vessels and the organs, is that something that once you get it in check, that the blood vessels and the organs can repair themselves?
That's a tricky question. It depends how far the damage has gone. So if there's a little bit of damage, what we call end organ damage, so say your kidneys, your brain, so you can get a little bit of brain damage through chronic high blood pressure or a little bit of wear and tear in the heart. Certainly, if you get in there at any time and improve the blood pressure, it's going to help. At the early stages, the body's amazing. It can heal itself a lot of the time. So
the message being the earlier you get it, the better. In other words, you have to go, and there can be no symptoms, so you got to go and get it done regularly, especially if you're men over the age of 40. Like
45, you're fine.
So I've learned a lot today. Thanks, Dr. Brian.
Thanks so much, Brian. Really informative. Thanks for coming in.
Right, still to come, we're practicing our penalty skills in case we get called up by Martin O'Neill tonight,
I don't have high hopes. We're also going to be meeting people raising money for charity with the help of their old-time family recipes. See you soon.